Hi all, thank you for joining. I see most of you are actually GHC members. So you've probably seen this face and Ensley's face as well. My name is Alisa Loch. I am the Director for Membership and Development at the Global Health Council. And we wanted to spend some time for those of you that are either new in the organizations that you're working in, or you're probably completely new to GHC and you just want to get to learn a little bit. We'll have a 15 minutes informative session. You'll get to learn about who we are, what we do, what's our mission, how we serve our members. But I think even most importantly, we'll provide a detailed overview of GHC member benefits and how you can stay engaged. So I want to make this very interactive. It's a small crowd. If you have questions as I go through the slides, please feel free to just jump in and ask. I can talk about anything on the membership side of things. Ensley is here as my wingman. Anything that has to do with advocacy, she'll be able to respond to that. So yeah, let's get started. I'm going to share my slides now. Okay. All right, so GHC, as most of you might already know, is a leading member organization. We are devoted to advancing global health priorities by uniting advocates, implementers, policymakers, and different other stakeholders. And we envision a world where health and well-being for all is ensured through equitable, inclusive, and sustainable investments, policies, and services. So we do have a lot of our values. This are already on the website. I am happy to just skim through to give you an idea of what this looks like on GHC's end. And so the first one is accountability. We hold our members, our partners, and ourselves mutually accountable to ensure that we're delivering very accessible, high quality, and impactful work. And we do also believe that the most effective way for us to achieve global health goals is through collaboration. And so again, as you know, GHC just brings together all these different voices so we can collaborate and continue advancing global health priorities. We do also believe that health for some is not good enough. So for GHC, we are aggressively committed to ensuring that all people have access to comprehensive quality health services when and where they are needed. And then we also promote inclusion in the work that we do. We strive to create an environment where all people, regardless of their race, their religion, sexuality, they feel included, valued, and respected within the GHC space. And then the last one is trust and transparency, which is one of the things that we highly encourage among our members, our partners, and staff. And we base our work on evidence and data. So a lot of this is really all stipulated on the website. Feel free to take a look at that later. And so we do have 4 pillars that form the core of the work that we do at GHC. The first one is multilateral engagement. And as I continue through the slides, you'll get to see that we do a lot of work with multilaterals, right? So WHO, UN, the World Bank, G7, G20, all of that. So we collaborate with the multilaterals. Health equity is a big chunk of the work that we do as well. If you joined the 8 a.m. Meeting today, the first webinar in the morning, you probably saw the presentations from different grantees in these organizations that are based in low and middle income countries. In GHC, we've come a long way, but we're doing an incredible work in trying to expand our membership to make sure that we have voices of marginalized communities. And so like you saw in the morning, that's a group of folks that have benefited from the grants that we're giving to different organizations in these communities so they can continue to advance and actually implement the advocacy plans within their own countries. Global health security is also another pillar for GHC. And then finally, and I would say this is the bread and butter for GHC, and that's the US Global Health Leadership. Everything that we do, most of the work that we do is really focused on pushing the US government. We have a clear understanding that the US government plays a critical role in advancing global health priorities across the world, not just here. And so a lot of the work that we do really is focused on making sure that we're doing that, we're communicating with Congress, and also pushing the administration on advancing global health security. We are a small but mighty team. We're a group of 5 now. We will probably be expanding by the end of the year or early January to 6. And just to clarify, GHC, really, we are the secretariat of our members, right? So the strength of the work that GHC does is based on our membership. Internally, this is how the group looks like, but we work a lot with consultants and interns to make sure that all the work that our members are doing is being showcased in a great way, and we're being supportive to the work that our members are doing. But the internal team, this is who you get to work with on a day-to-day basis. And so I did mention earlier that we have a diverse membership. I would say over 70% of our membership is INGOs, and that is international non-governmental organizations. A lot of these organizations either are based in the West, could be US, could be in Europe. Most of them will have in-country offices in LMICs. So a big chunk of our membership is really non-governmental organizations. And then we do have philanthropic organizations. So we have funders that are also part of GHC memberships. We have corporations, think the big pharma, right? Pharmaceuticals like Pfizer, Johnson & Johnson, those are also part of the work that we do. And we also do have a clear understanding that there's no way we're going to win this fight if we decide to, just fight this from the public sector alone. And so we do also think there's a place for the private sector. And so we do have corporations within the GHC membership. We have smaller consulting firms. We have associations and coalitions. And then we have also universities and colleges, mostly departments that work on public health, public policy, anything that has to do with health. They've also, joined GHC to be able to be in the same space with other global health advocates. One of the things to flag here is, as a GHC member, because we serve as your secretariat, if you do feel like, hey, Alice, I want to connect with Abbott, or could you make an introduction to me, for me to this organization, we are able to do that. That's where we stand as an organization, is we can be able to do that. However that conversation goes is definitely up to you. But again, these are the members that are part of GHC, and we also continuously create spaces for you all to connect and be able to find partnerships in that space. So I'm going to skip on the successes because this is a lot. I'll give a bit of a highlight. As I mentioned, because we work with multilaterals, pushing for strong global fund replenishment is one of the things that we've done. And I'll get to talk about WHA in a minute, but we host regular meetings, we host town halls, fireside chats with US and global decision makers. We host webinars. I mean, I think this year we've done a lot of one-on-one webinars. You've probably been seeing a lot of emails from Ensley on that. And the one-on-ones, we open them to the public. And then we have the ones that are very specific and exclusive to GHC members only. And so, again, we always make sure that we are presenting that information to you in a timely manner. I now want to focus on the 3 buckets that I think, as a GHC member or somebody that's interested in joining GHC memberships, this is the one thing that you need to be aware of. So we do have 3 buckets. Different members join GHC for different purposes, right? There are folks who come to GHC, you want to do advocacy with us. You want to go to the Hill with GHC. You want to participate in signing on letters to go to specific members of Congress to push for specific legislation. You want to participate in pushing for funding for specific programs. This is your space, right? So we do advocacy. We have access, and I'll get to talk about what that looks like. And then the organization also who joined GHC for the sake of amplification, right? You want to connect, but you also want a space where you can amplify the work you're doing. And so, again, this is just to say, it doesn't really matter why you're joining GHC. we have three big buckets where I feel like a lot of people would still fall in any of them. So whether you're coming in for advocacy, whether you want to get access to high-level meetings, or whether you want to amplify the work that you're doing, GHC really will provide that platform for you. Now, as we go down to advocacy, we currently have 8 working groups. Previously, if you've been in GHC for a while, you know this as roundtables. Now we call them working groups. It makes more sense because people really connect in that space to do the work, right? Out of these 8 working groups, the first 6, budget and appropriations, multilateral engagement, global health security, maternal, newborn, and child health, health system strengthening, non-communicable diseases. The 6 of them are open to anybody that is a GHC member. If you join GHC memberships, you're welcome to join any of them. I have members who come in and they're very specific. They'll say, Alice, I'm just interested in maternal, newborn, and child health. That's totally fine. If you come in and you're sort of on the edge, you're not sure which specific working group you want to be part of, feel free to attempt or attend any of them. We only have meetings once a month, so you can decide, maybe I'm going to do budget appropriations this month, and next month I'm going to do this other one. So feel free to join any of them as you make a decision on what, the specific ones you want to attend. The last 2 that I didn't mention, Health Equity Working Group, we started this earlier this year in February. And this is the only working group in GHC that has a caveat. Okay, this one and the middle one. So the Health Equity Working Group was really GHC creating or wanting to create a space for organizations that are based in low and middle income countries to be able to come together, co-create without us telling them what's needed in their own countries. And so this is the only working group in GHC which is not open to everybody. If you're an organization that is based here, but you have an office, say in Nigeria or Uganda or Kenya, and you have a staff member that's based there, they can sit in this working group. If you're based here, unfortunately, you can't for reasons based on what I just explained. And then the meta working group really is just for bringing together the different co-chairs for all the working groups once a month so they can collaborate, share information, align strategy, and all of that. Again, as I said, you as an aspiring GHC member or as an existing GHC member, if you already don't have access to any of these working groups, please feel free to reach out to me so we can make sure that you're added on this. You have 5 slots, which means you don't have to be the only one from your organization that's joining this. You can, assign different other staff members to attend the different working groups as well. All right, so we do have the Global Health Briefing Book, which we publish every other year. It serves as a resource for Hill staff and Congress. I will say generally, the information that goes into the Global Health Briefing Book honestly can be applied across different countries, and you're welcome to do that once we publish it. We do this every 2 years, so we did this in 2023. The next one will be in 2025. This is another space as a GHC member. If you would like, and I know Ansley will always, this is another co-creating process with our members, we will always send emails out to ask members if they're interested in providing content based on your expertise, the things that you're working on, your issue expertise on different issue areas. So feel free to do that, to contribute to this if you're interested in it. And I do think that the time now is done, right? Okay, so we're done. I will skip the advocacy part. A lot of this in GHC providing thought leadership, this is already on the website. You have access to this as well. And then I'm going to move along to access, right? So one of the other buckets that I talked about that's important to remember is the access bucket. And in this, GHC has official relations with WHO. So every year, we take a delegation of our members to Geneva. Again, it depends with GHC does provide passes to our members, but again, it really depends on how many passes we get from WHO. The most important part to remember is we collaborate with our members through this process. If you want to be in the weeds in terms of drafting the statements, reading out the statements in Geneva, you're welcome to do that. If you're interested in just getting an email that says, hey, this is what happened, then that's fine too. So every year we'll reach out to you and ask, are you interested in being part of the WHO process, WHA process? And then we work together collaboratively to draft specific statements based on the issues that we want to show up in during the World Health Assembly. And then again, we also have the ECOSOC accreditation with United Nations. So as a GHC member who is active and paid up, you can take part in either the WHO or any UN convenings. And then still in access, I think earlier I did mention earlier that we provide access to different things, right? So one of the things that I mentioned is we provide one-on-one webinars. The one-on-one webinars are open to the public, very educational, informative. We'll do a WHA 101 so we can educate our community on what's happening during the WHA process. We'll do maybe a budget and appropriations webinar. Those ones, we open them to the public. However, we do also host town halls. For example, we might bring somebody from USAID, right, like Atul Gawande. And these ones are very exclusive to GHC members only. If you're not a GHC member, you do not have access to that. The reason we do that is we want to create a space where our members can get to have transparency, accountability for all these multilateral organizations that we are working with. And sometimes it might be somebody from the US government. Again, so that's another thing that we provide access to. We do also have a lot of, let me not say a lot of, but we try to have in-person convenings. One of them is a symposium that we converted into a virtual event this year. But we also have happy hours. We try to at least have an event every quarter. For the happy hours, we might have it, we have a lot of them in DC. Sometimes when we have major global health events like World WHA, we might have, and we always have a networking event. So last year we had a very huge networking event in Geneva. We invited, again, all our members, including anybody who's in the global health space. So if you want to connect with partners, funders, people that probably are doing the same work that you're doing, GHC intentionally does that. So we're not just getting from you, but we're also providing a space for you as a member to connect with other folks that might be doing the same work that you're doing. So that's that. For the folks that are interested in the health equity work, I think it's just imperative for you to know, we serve as the Global North Civil Society rep. Actually, I think we serve as the alternate on the Pandemic Fund Board. And then we serve as a representative on the UHC 2030 Steering Committee. In this case, GHC will show up, and a lot of times I think it's either Eliana or it's Elisha showing up in those specific spaces as a voice to the rest of GHC members, as a representative in that space. And then last year, we got appointed to sit at the WHO Civil Society Commission. And so for those of you that are specifically interested in the Pandemic Fund or UHC 2030, we can always provide more information on what's happening in that space. All right, so the last thing that I'll talk about when it comes to access, which I actually don't need to talk about because this is where we are. So this is the symposium. GHC, again, as I said, we convene our members and folks just in the global health community in general to connect, raise awareness, providing a platform for you to exchange ideas. And our symposium is one of the ways that we do that. Again, this is just a screenshot of the theme for this year and what we've been focusing on. So now I'm going to move on to the last thing, and then I'm going to open it up to questions. For those of you that might have questions generally, amplification, this is one of the fun things that I love doing. GHC highlights, we actually have one of the things that we call member spotlight blogs. When you come in as a new member, we will request you to do a member spotlight blog. And It can be very specific on a project or program you're working on that you want to highlight. It can be you just talking about generally what the organization does. Once it will send you everything, specifications, guidelines on what we like, requirements, how long should it be, and all of that. We use the blog to introduce you to the rest of GHC community. So if there are people who want to connect with you, members that probably share similar work to what you're doing, then that's how they get to know about the work that you're doing. We co-host webinars. We just need to know in time, because as you can see, we are a very small team. If you want to co-host a webinar with GHC, sometimes members have said, we just want to use your logo, right? Just let us know in advance. Or some of them will say, can I have Ansley from the advocacy team speaking on this specific thing? We just need to know in time if you want to co-host a webinar with GHC so we can make time for it. But again, as a reminder, it is a GHC member benefit. And then the other thing that we do on amplification is we drive attendance to your events. If you have events coming up, I think this is one of the things that we don't have our members taking advantage of enough. If you have events that are coming up, we do have a community calendar. You can add them on the community calendar. We do also, you can also send it to us. We'll send it to our communications team. We can amplify as long as we have the materials. We'll send it across our social media channels, our listserv, our newsletter. We're able to do that. So if you have events coming up, don't hesitate. Just reach out and we'll be able to provide a platform for you to do that. And then lastly, take advantage of our social media platforms. Right. The last thing that I want to talk about is the money. So as a lot of you might already know, GHC is a paid membership. We go all the way from organizations that are less than 1 million. I have to say, this is a new level. So we recently created this for organizations that are based in low and middle income countries. And it was just a need for GHC to be equitable, make sure that, again, as I said, we're expanding on the health equity work to make sure that we are providing space for members to be able to do that. The ones that have maybe lower revenue, lower budgets, to have access to GHC membership. Again, as you can see, it goes all the way to 1 billion. Depending on how much revenue your organization has. So I'm not going to dwell on that, but if you have any specific questions in terms of where do you think your organization will lie, I am happy to have that conversation with you. All right, so that was short and sweet. I was trying to make it very short, but I want to open it up to questions if you guys have specific questions on anything that I can help respond on. And feel free to unmute yourself.
Hi, Alice. Great job. This is Paul. I've been a member for a little while, but I obviously needed this. So thank you, number one. I have several questions, but I don't want to hog space.
Go for it.
Okay. Number one, can we have a copy of your presentation?
Yes.
Excellent. Number two, who manages and directs you say you have a grant program for members or partner organizations in lower middle income countries. When coalitions start implementing like that, it's always interesting and can be challenging. Who does that exactly, and how is that overseen by the staff or the membership?
Yeah, Eliana is the one that's in charge of that. I will be happy to, if you do want to have a chat with her on how that's run, I'm happy to make that connection with you. We have been lucky. We started this with a small grant. It's not like we give a lot of money, but we started this, I think this is going to be the 3rd year that we're doing it. So we started it about 2 years ago. We were lucky to continue getting the funding to be able to do that. We've only supported about 5 or 6 organizations in a year, but we're also very intense in the way that we do it. We support them all through. Like when we did it the first year, we actually took them through an advocacy toolkit that we had co-created with the civil society engagement mechanism. And then they were able to take that information, implement it in their own countries based on their needs. So Eliana would be the person to talk to.
Great. Yeah, no, just it's
Yes.
very obviously many organizations like ours that are implementing also do advocacy capacity strengthening in different ways. And since we're sometimes in the same countries, it would maybe that's good to know or to share, but that's interesting. I have a couple more, but I don't know if there's
Yeah.
someone else who has a question.
No, I think keep going. I mean, I think we have time, so feel free to keep going.
Okay, I just want to make sure others aren't. So on your list of members or associates, or et cetera, we have some pharma, pharmaceutical organizations, corporations as well. So just out of curiosity and other associations, et cetera. So there's some consulting firms, some lobby firms, and right now I'm working on an issue in which several members of Global Health Council probably have different opinions about. And one of the issue, and this issue is so polemic in some ways that it's raising the issue of transparency, right? That maybe some members, or at least those listed that you just showed, are not being transparent with the rest of us. So I don't want to bring it up right now, but just curious, and maybe Ansley, you can get back to me on this RUTF. What's going on from Global Health Council's point of view? I just curious, because
Yeah.
this is a major, in my opinion, this is a major issue which could cause problems for all numbers of coalitions. So that's just one question. But more generally, let's say, does Global Health Coalition come up with opinions or position statements about access to pharmaceuticals, and is every member kind of part of that process? I was just curious how you balance what must be obviously very different perspectives from very different members on key policy issues over.
Yeah, I'm gonna let Ansley jump on that one.
Too kind, Alice, too kind. Thank you. Paul, it's a good question. On the RUTF situation, I've been tracking it, understanding that a lot of those discussions have been happening within the interaction, food, and nutrition security sort of working group. So right now, the way I'm approaching it is to talk to as many people as I can about the different perspectives, to learn about exactly what's happening. A question popped up the other day related to our FY25 conference letters. So I understand that it's a big issue. I think, historically, the way we've handled our US advocacy is to advocate at a higher level. So just the funding lines within USAID, state, CDC, and NIH. And obviously we're in the fight on things like PEPFAR reauthorization and other things where folks have somewhat varying opinions, understanding that the RUTF situation is a little bit different than that. I think because we are sort of the big tent, GHC looks to, like, let's say the Global AIDS Policy Partnership, for instance, to really be leading the fight in PEPFAR reauthorization with sort of GHC side by side. So it's really a case by case basis on how we can sort of manage the different and varying perspectives of our members.
That's fine. Again, on the actual issue of whether RUTF should be mandated or soft earmark or something, I'm not even talking about that. I'm talking about honesty and transparency by members of Global Health Coalition to each other and to other members of Global Health Coalition, as well as members of Interaction. So this is about misrepresenting oneself on Capitol Hill. It's a much more serious issue, I think. I'll drop it. But just so you're aware, Ansley, this is obviously one where if you say your values are this, is there any mechanism? And I would say the same thing to Interaction, Anthony. Don't get me wrong. I'm not trying to beat up a Global Health Coalition. This is a difficult and potentially divisive issue, but I'm just raising it because for me, I was kind of gobsmacked by the fact that a prominent foundation and a prominent lobby firm who works with our community would do this in ways that at least there's some documentation or at least some allegations that this has been dishonest and not transparent. So I raise that because this is a way to divide the community, and obviously if you're a big tent, you have to let this stuff be worked out maybe in a different place, but that's why I was raising it. This has been really helpful. The only other thing is was the question of access. I want my health staff, who of course are incredibly busy. We don't have a lot of advocacy capacity. We don't have grassroots, which is why, Ansley, I love having it at the high level. It's much better for me. It's much better for our organization, which also is part of Interaction and other coalitions. So it's extremely helpful. I am interested in, I'll shut up now, on how my health staff can be, since they're already part of other health coalitions, core group and on specific stuff. I just want to make sure that they are aware also of your role and their capacity or ability to participate in some of the things you do, whether that's multilateral or otherwise. I obviously have not had time to be part of that roundtable, but have greatly appreciated the GHS, the MNCH, great connection with AID, and obviously will be very interesting to see what happens in the next administration. So thank you just for everyone that's part of GHC staff. Over.
Thanks, Paul. I would love to connect with you offline about the RUTF situation, so I'll send you an email, maybe we can set up some time. As far as access, I think making sure that your other staff are on sort of our general listserv so that they get the invitations for town halls with USAID or other folks will be really important, and Alice and I think Sierra can also help manage to make sure that your folks are on those right listservs.
And there's no problem for any one of my staff. If I can't make a roundtable or a working group, any one of my other staff can attend. I'm assuming that's never been a problem, right? Over.
Yeah, as long as they're affiliated with the organization, I believe that's right, and Alice can correct me if I'm wrong on that.
And if you're the only one who's registered, you do have 4 extra slots. So you have 5 per organization. You can let me know if you have 4 other folks that you want to delegate in the different working groups. You're welcome to do that. We'll just add them in. All right. Any other questions?
Hi, Alice. This is Barb from Mothers to Mothers. It's nice
Hi,
to
Barb.
see you. Hi. I'm not very camera ready today, so I'm not going to turn my camera on.
It's okay.
But I did want to ask if, first of all, we've been a member for about a year and we have really benefited from the membership. We're thrilled to be part of GHC. And it's good to kind of just do a refresh on what services and events and things are available for us. I did want to ask if GHC is planning anything for World AIDS Day, since it's coming up fairly quickly in just over a month now. And then I know you've got an event plan just to the implications of the new administration, but maybe you want to put a plug in for that. I think it's in February. Thanks. Over.
Yeah, sure. Ansley can comment on the World AIDS Day, but not that I know of. Are we doing anything? No.
I don't believe so. If you're looking for a specific, I don't know, Barb, if you're part of the Global AIDS Policy Partnership, but they're the ones that usually have some like a Hill event and other sort of like campaigns associated with World AIDS Day. We can check in with Eliana since she directs our sort of international advocacy work, but to my knowledge, we're not doing anything specific.
Thanks
Besides
for that. Oh,
partner.
sorry.
No, sorry, go ahead.
Appreciate that. Yeah, no, we are part of GAP, and I think we're actually putting together a blog for something they're doing. I just wasn't sure if GHC did anything independent. I did want to say that I think one of the things that we found most beneficial to our membership has been the fireside chats, and especially the closed member only events. We are thrilled with the access we have, and we feel like we've gleaned so much phenomenal information, from Atul to Christina Yarrow to Nancy Lowenthal and her team. So thank you, and we hope you all have more planned in the year ahead, because those, I think, have been really extraordinary. Thanks.
Yeah, it's good to hear that. Ansley is definitely the queen of those ones.
That's kind, Alice. Just to mention what Barb talked about in February, we are having an in-person member only day on February 13th to really dig into the potential impacts on global health of the new administration and shifting political landscape on Capitol Hill. I think as far as the fireside chats go, Barb, I think it'll be interesting to see how that shifts with the new administration. Obviously, we hope to continue our relationship building, but it will be a new challenge, I think, given some of their proposals. So just know that we'll be tracking how things are playing out, and already hearing about a few murmurs. So we're thinking ahead for sure into next year.
Thank you so much. And I was just going to put a comment in the chat to say, I don't know if the agenda, how far along you are, but we would highly recommend a social event, maybe a happy hour at the end of the February gathering, just because we feel it's so important. That's what we were looking forward to with the virtual day, just in person, face-to-face time. Not the happy hour, but just really getting, you know, those informal discussions that you can't really do in a format like this. So would highly suggest that that's part of the agenda. Thank you so much, Alice and team. I think you guys are doing a great job. Over.
Thanks, Bob. And yes, we will have a networking session at the end of the day. We will actually map what was meant to be the 21st that we decided to convert it into virtual. So it's going to be the same thing, similar. We'll have breakfast, we'll have lunch, and then we're going to have a networking session at the end. We'll have a few plenaries, but I think even more important, creating time for the working groups to meet in person and like deliberate, as Ainsley was saying, on like the impact of elections going forward in our global health work. So yes, and I agree with you. I mean, to me, it's always that space to meet people in person and just not be on the screen all the time. So we'll make it happen. Anyone else?
Yeah, this is Pauline.
Pauline.
Thank you so much for sharing with us about GHC. I'm not yet a member, but applying, and I really wanted to understand what GHC is. I learned about it from Community Health Impact Coalition, where we are a member, and so we picked interest as an organization. So probably you'll be seeing our application soon. But then my question is,
Pauline, I think we lost you.
sorry.
Yeah, we can
Can
hear
you
you
hear
now.
me?
Mm-hmm.
Okay, sorry about that. So I'm just wondering.
You might have to turn
I see
your,
there are
yeah.
several working groups, and I'm just wondering if maybe I turn off my video or something.
Yeah,
Yeah,
that's
if
okay.
there are any strict rules like to attending the working groups, like for example, if I don't attend, is there anything that really will the organization be charged for not attending meetings consistently if that really happens?
We should probably start doing that. No, not at all. I'm just joking. No, we don't charge you for not attending. You have access to the meetings. Once you join as a member, we'll give you access to what we call Box, where we store like all the information, the agendas on the upcoming meetings, what we've discussed in the previous meeting. So even if you miss a meeting, you can still go back and like review the notes, and then you have access to our team. So if anything was discussed and you're like, oh my gosh, I wasn't in that meeting, I'd like to know more information, you can reach out to the advocacy team and they'll be happy to take you through. But no, we don't. Once you pay your annual fee, you are free to attend and you have access to all member benefits as a member. We don't charge you for not attending.
Thank you.
Yeah. And Pauline, I'm going to put my email in the chat in case you want to chat separately. I'm happy to talk you through the application process.
All right, that's great. Thank you so much.
You're welcome. Anyone else? If not, I am happy to give you back a few minutes back. Again, I put my email in the chat. Feel free to reach out if you have any specific member questions or any other GHC related questions. I'll be happy to direct you to the right person to respond to that. But once again, thank you so much for joining. Those of you that are GHC members, we appreciate all of you. Those of you that are not GHC members and hopefully wanting to join, we look forward to, bringing you on board. Thank you, guys.
Thank you. Bye-bye.
Bye.
Thank you. Bye.
Bye.
Thank you.
Bye-bye.
Bye.